We're just thrilled to have Dr. Rosalin Preechakul with us from another super high performing medical group, Kaiser Permanente Downey Medical Center. So one of the things that we're seeing in the Kaiser data this year is a lot of variation, more variation in blood pressure control, especially negative variation in certain centers. So Rosalin is a PharmD who can talk to us about how adding the pharmacist to the care team has made such a difference in Kaiser Downey being a positive outlier in the Kaiser system. So thank you, Dr. Preechakul, for being with us today. Next slide, please.
Thank you for the warm introduction. Thank you for having me today. So I'm honored to be able to share the work our team at Kaiser Permanente Downey has been doing to manage ASCVD. Next slide, please. I have no conflict of interest. Next slide, please. This is a brief intro about KP Downey Medical Center. We serve the southeastern LA County since 1965 with over 430,000 members. We provide numerous pharmacy services, including 18 ambulatory care pharmacy programs. Next slide, please. So over the years, our program has experienced significant growth and expansion. So here's a list of all our clinical ambulatory care pharmacy programs at KP Downey, and today I'll be highlighting our complete care service. Next slide, please. So the key to being able to expand our AmCare program is the people, to have competent ambulatory care pharmacists. To build and maintain trust, it's important that we not only demonstrate competence in managing chronic conditions, but to maximize the pharmacist's scope of practice. And you're able to achieve this through the collaborative practice agreement. Embedding an ambulatory care pharmacist directly into the team is essential for a successful model. We also utilize population health data. Through our electronic health record system, we identify patients who are at the highest risk, and this approach allows us to proactively manage care and close clinical gaps before complications arise. Our chronic disease management efforts are also data-driven, with measurable outcomes that align with nationally recognized quality benchmarks like HEDIS, Medicare Star, and CalPERS. Next slide, please. So here, physicians will always retain the critical role of diagnosing the patient. Because we have an electronic CPA, it empowers pharmacists to initiate and manage medications to act as extensions of the medical team. As you can see here, our pharmacists are highly trained with advanced qualifications to maximize their scope of practice. Next slide, please. Our complete care approach focuses on management of key chronic conditions such as hypertension, diabetes, and hyperlipidemia. We have about 80,000 patients with hypertension and 50,000 patients with diabetes. The purpose of the program is to support primary care in the clinical management of cardiovascular diseases within the HEDIS populations to improve patient compliance and health outcomes. Our goal is to elevate quality of care and performance metrics. And one way to do that is by managing medications and chronic disease follow-up. So our physicians can focus on complex cases and ultimately improving access to care. So we actually have similar hypertension workflow to what Dr. Mehta mentioned in Palo Alto. Our approach is to embed care managers into the care team to reduce physician burden and enhance provider satisfaction. And what is the impact of this? Our patients receive more personalized, convenient care through a multidisciplinary team approach, therefore improving their overall experience. Next slide, please. On this slide, we are reporting performance with outcome data. This is a table of KP patient population by race and ethnicity, and KP population are similar to the SoCal general population, with the highest being Hispanic or Latinos, followed by the non-Hispanic white. We also have challenges at KP Downey. We continue to see disparities in the African American and Latino population. So it's a work in progress for us as well to try to close this disparity gap. On the right is BP progression over the years. To give a little history, our KP Downey BP program started in 2007. Our BP control rate back then was at 74.2%. The table is a snapshot of the recent control rate in 2024 and 2025. You were at 84.3% May of last year, and now at 84.6% May of this year. Now, while achieving high rates of BP control is important, equally critical is the ability to maintain that control over time. You're fully aware that it's not just about reaching target levels once, it's about maintaining a healthy BP range. And this can simply be done by regular follow-ups, medication adjustments, side effect management, and ongoing BP monitoring. At the bottom is a table of our average BP control in 2025 at 3 months, 6 months, and 1 year mark. So we're proud to share that KP Downy BP control rate is approximately 80% throughout the year. Next slide, please. Our approach to managing ASCVD is to look at the full clinical picture. At the heart of our care model are the care managers. Everything is assigned to funnel into the care manager's workflow where they serve as a center where all touch points converge. Every interaction ends with a scheduled next step, whether it's a visit, a phone call, or a lab. We don't want any patients to leave without a follow-up plan. The closed-loop process reduces care gaps, improves outcomes, and builds accountability across our care team. Next slide, please. So there are 3 main strategies that we employ at Downy for BP control. There is an in-person BP check that prompts real-time medication titration. When patients arrive for BP checks, care managers in partnership with the back office staff to evaluate readings and titrate medications on the spot. This partnership between the care managers and the nurse clinic enables immediate action and improves patient outcome, while also helping to free up physician access to more complex cases. We also utilize home blood pressure monitoring, where patients report their blood pressure readings using a validated home device, and this approach empowers our patients to take an active role in managing their BP in a convenient home setting, helping to eliminate the effects of white coat syndrome. So through telemonitoring, the care managers can track trends, assess BP control, and intervene when necessary. By shifting routine BP checks out of in-person workflow, we've also improved efficiency and improved access. Also, health fairs. These quarterly large-scale health fairs offer in-person group-based appointments designed to support chronic disease management. So by providing weekend access, we offer added flexibility to meet our patients' needs. We leverage bulk outreach to help raise awareness, where we proactively outreach approximately 500 to 600 patients for each event. Services offered include BP checks with on-the-spot medication titration, diabetic retinal screening, foot exams, mammograms, and more. The goal is to address care gaps, promote preventive care, and help patients better understand their health risks. Next slide, please. Our model is built on the foundation of a holistic, comprehensive, team-based approach, with care managers playing a central role in the day-to-day operations. So throughout the presentation, we've touched on some of these elements, and now we will highlight the other remaining ones. Next slide, please. So our care model is designed to operate virtually, where we collaborate with back office staff to check in patients, get the BP readings, document in the EHR, allowing our provider to do real-time medication titration and make clinical decisions without having to wait for in-person encounters. We have structured process where no patient leaves without a follow-up plan. You want continuous engagement to reassess needs, address barriers, and reinforce healthy behaviors. We also leverage data and analytics to track performance and use dashboards to monitor progress to reach our goals. Next slide, please. So thank you for the opportunity to share our workflow. I hope it provides some valuable insights into how we manage our patients using a variety of strategies. As we reflect on the theme Stronger Together, elevating outcomes through collaboration, I challenge you to take these ideas back to your organization and explore how can you incorporate an ambulatory care pharmacist into your care model. Thank you for your time.